Good afternoon and welcome. This webinar will be recorded and slides will be available at the initiative's Padlet. Next slide, please. The work we are doing with the expert webinar series is part of a larger initiative that includes coursework for educators. If you'd like to learn more, please visit the links that are in the chat for the initiative as a whole and to enroll in the course bundle. Jessica, hand it over to you.
Great. Thank you, Rebecca. We are thrilled to be partnering with the Washington State Department of Education, OSPI, for our Structured Literacy Within an MTS Framework initiative, which is responsible for this expert webinar series. For those of you who may not yet know about Glean Education, we partner with schools, districts, and states to deliver online training and web-based coaching. We help teachers understand current research and implement evidence-based literacy practices to improve student literacy outcomes. This webinar is a first in a series of webinars this year on structured literacy within an MTSS framework, featuring some of the nation's top experts. If you haven't registered for them yet, we'll be putting the links in the chat for registration, so you can click on that and register there. Attendees who register and attend the full webinar are eligible for 1 clock hour per webinar. To kick off this webinar series, I am thrilled to welcome Washington's own Dr. Jan Hasbrouck. Dr. Hasbrouck is a leading researcher, educational consultant, and author who works with schools in the U.S. and internationally. Dr. Hasbrouck has worked as a reading specialist and coach for 15 years and later became a professor at the University of Oregon and Texas A&M. Her research in reading fluency, academic assessment, and interventions and instructional coaching has been widely published. She is author and co-author of several books, curriculum materials, and assessment tools. She continues to collaborate with researchers on projects related to reading assessment and intervention, and enjoys volunteering at her grandson's K-8 school in Seattle. She is the founding member of Read Washington, working to build awareness of literacy instruction through high-quality professional development in Washington State and beyond. Please welcome Dr. Jan Hasbrouck.
Thank you, Jessica and Rebecca. It's really a pleasure to be here to talk with you about oral reading fluency assessments. So let's go ahead and get started. We have plans for me to present for the first chunk of our time together and leave plenty of time for questions. So you can be putting questions in the Q&A if you want, and we'll get to those toward the end. Fluency is the general topic here today. I'm specifically narrowing in on assessments, but because we really do have limited time and there's always so many questions left over, I wanted to give you some other resources. And I just want you all to know too that much of what I'm going to be sharing today is from this book that I had the great pleasure of co-authoring with my friend and colleague, Deb Glazer, where we do a broader look at reading fluency, but including our topic today of reading fluency assessments. Deb and I also work together on an ILA brief for the International Literacy Association on fluency. This also is more broadly about reading fluency, not specifically just about the assessment, which I'm going to zero in on today. Some of you are likely, I hope you are, members of the Reading League. And if you are, you might also receive a copy of their journal. I wrote a chapter or an article in their journal back in September of 2020. It was an update of what we know about reading fluency since the National Reading Panel report came out. And this is not yet available, but some of what I'm going to be sharing today is going to be included in a book. I wrote a book previously called Educators as Physicians, and now am in the wonderful position of being able to update that. Wonderful because I'm bringing on a co-author. I know many of you in Washington State know the work of Margaret Goldberg, who currently works as a literacy coach in California. So we're going to talk about assessment, and I want you to know right off the get-go where I come from in this discussion, because like a lot of things in reading, I think there are philosophical orientations or philosophical perspectives that people have, and I have formed one over the many decades that I've been doing this work. So I want to share those with you. First, before I get to the philosophy, I want to share this quote with you. Because I really resonated with it when I first read it from Jonathan Cohen, that educators are now used to data being used as a hammer rather than a flashlight. I so get where that statement is coming from. My entire orientation around data is to use it as a flashlight. Data assessment is never, ever the most important thing we do. But as you'll see, my philosophy is about the necessity of doing it and doing it right. So first part of my philosophy is I think I'm in agreement with a lot of educators and some parents in the community too, that think perhaps we're just doing too much testing. I think we have to be very careful about that. If we're doing too much testing, though, we can't throw out the baby with the bathwater, because we must assess our students, because when we get that right data that answers important questions, our instruction is better. So I'm all about collecting the right data, knowing what the important questions are, and then doing it as quickly as possible. And the fourth part of my philosophy is, if we're going to spend time and resources and everything, if we devote time and resources to collecting data, let's make sure we use it and use it correctly. It just kills me to see how much time and effort and money and resources, general resources, are being done in a lot of schools collecting data that either at the end of the day is not being useful for quickly answering questions about instruction. So that's what I'm all about. That's what the focus of our conversation here today is about, answering important questions. And there is some research to help us decide what those important questions are. And I want to share those with you, because I think I know for all teachers, for any one of our students, we could come up with 100 questions easily about who this child is and what is their background and what is their life like outside of school and what kind of instruction did they get before they showed up for me, and all kinds of things we'd love to know about our students. But we don't have the capacity, the wherewithal to get the answers to all of those. So in terms of reading particularly, researchers have looked at what is essential for us to know as educators so that we can plan and deliver and adjust our instruction for the most impact, the best outcomes. So these are questions, and you may have heard of these before. The first question that I think we should start with, and the research says we should in reading, is to identify who our students are who might need some extra help. This is especially important in the early grades, when we may have in kindergarten and first grade a whole room full of kids who don't look like they read. They don't read yet. The expectation is not that they are really readers, but to know as early as possible with the youngest students who might need help is a critically important question. It remains important throughout the grades, but from all the things we've learned about early identification and early intervention, it's especially important early on. Once we've identified a student who might need some help, The next question that the research says we should turn our attention to is, what help does this student need? Now we get down to the individual level and say, okay, it looks like this student might not be at benchmark, but what is the cause of that? Reading, as we all know, is a very complex thing. What is it that we should do a closer look at? Those are the first two questions. And then those are the two, answering those two questions really helps prepare us for instruction. Who needs help? What kind of help do they need? We use that information to design instruction, and then we start doing the very best instruction and intervention that we possibly can. And then there's a third question. The third question is asked as instruction is being provided, and that is this one. Is the work working? Students working really hard. I'm doing the best I know how to do as the teacher. Is all this work working? Is the student moving forward? Are gains happening? Are the students moving toward their instructional goals? So when we turn our attention to that first question, who might need help? That is the question where we turn to a category of assessments that we often refer to as screening assessments, sometimes benchmark assessments. That second question, what help does this student need? There's a whole different category of assessments that we should be referring to as diagnostic skills assessment. These are different than the assessments that special educators, school psychologists might use to diagnose a handicapping condition or a disability or a dyslexia or something like this. This is really aimed at the kinds of assessments that classroom teachers can use to make some determinations about the skills involved in reading that each student has or does not have. The question, is the work working, turns us to yet another category of assessments that we refer to as progress monitoring assessments. And each one of these questions and the accompanying assessments could be an entire webinar on its own. Today, I'm going to be focusing on a set of assessments called curriculum-based measurement. And I'm going to narrow in on the reading assessments from that suite of assessments. And I'm going to specifically be talking about one CBM assessment called often referred to as ORF, which stands for Oral Reading Fluency. This assessment was invented about 40 years ago. And when it was originally invented, it was simply a set of procedures to use. Nowadays, at least for the last 20 years or so, we've had commercially available versions of these assessments. So some of these names may be familiar to you. There are a lot of schools in Washington State using some version of these commercially available assessments, but all of them are curriculum-based measures, and all of them include a measure of oral reading fluency. So ORF, the one we're going to focus on today, is, as I mentioned, just one of a number of CBM measures. The original researchers not only looked at reading, but also writing and spelling and math. In reading, there are several measures: letter naming fluency, letter sound fluency, nonsense word fluency or non-word fluency, word reading fluency, ORF, the one we're going to focus in on today, and maze. So in most of these, what's involved is a 60-second assessment of a cold, unpracticed read. We're going to be talking about text reading. The ORF is oral reading fluency of text. But whether you're doing sounds or letters or individual words, the read is cold, unpracticed is what that means. And students read aloud for 60 seconds on the ORF assessment and the other assessments. And we always want the students' best effort because we're going to use that for important decisions. For oral reading fluency, the score that we obtain after the assessment is, the metric that we use is words correct per minute. And I know a lot of you are very familiar with that. We can use the very famous Scarborough's rope infographic where she so brilliantly represented the complexity of reading, represented by two major areas, language comprehension and word recognition, and showed that the individual strands of those two major components, how they contribute to the outcome of reading that we want. Over time, those skills get developed and interwoven, so that we hope most of our students ultimately end up at the skilled reading level represented by that tightly woven rope. But those CBM measures can be used as reading develops. So we can map onto Scarborough's rope some of these assessments. The letter sound fluency and letter naming fluency play a big role at the very early stages of learning to read. Once students are moving toward decoding words, we can use the CBM measures of non-sense or non-word fluency and word reading efficiency that some of those assessments include. Today, we're really focusing on using the text reading fluency. Once students are reading connected text, the ORF or the Maze assessment can be used. In oral reading fluency, it's sometimes referred to as an informal assessment because it is so short, because you don't need to be a school psychologist or have a PhD to administer that ORF assessment. So it looks rather, and it's short, all of those kind of things, that it looks like it's an informal assessment. It actually is a standardized assessment, and it's standardized because of the research that was used to construct the framework of the ORF. And it's standardized both in its scoring and its administration. So I want to review, and I know this is a review for most of you, the scoring standardization, where all of those assessments, whether you're using Acadience or Easy CBM or Dibbles or any of the other variations, they all use that original CBM research to standardize the procedure. So we count errors in a certain way. We count errors every single time they're made, which a lot of these ways of scoring are a little bit different than some of us may have been taught, but because it's standardized, we have to do it exactly the same way all the time. Every time a word is substituted, even if it's pretty close in meaning, it counts as an error. We give students about 3 seconds before we pronounce the word for them, and that counts as an error. Sometimes at the early stages, we might give them up to 5 seconds, but usually it's 3. All omissions, words that are transposed, that counts as 2 errors. Self-corrections, though, are not considered errors. Repeated words, errors made because of dialect or speech impediments. Punctuation is not counted in an ORF scoring. Words that are inserted are not counted as errors. They're ignored for the purpose of scoring. And then at the end, you take all those errors that you've counted and subtract them from the total words read and get the score of words correct per minute. Sometimes people refer to that as correct words per minute. So that's a very quick overview of the scoring. The administration also is standardized, and it's really important. And I want to make this point very clear because this is one of the places I see people perhaps not being as standardized as they should when they're doing an ORF assessment. All of the assessments say you must say some specific directions to students. And I know, because I've administered maybe thousands of these assessments to children, that some of our students have done these assessments a lot of times, especially if they get up in the grades and they know what to do. But we're supposed to be very standardized in what we say to the students, and at least in making sure that whatever we say to them, that they are very clear that this is not a race. So there's a book, a general book about curriculum-based measurement that I love called The ABCs of CBM. And they say when you're doing an oral reading fluency assessment, you should say something like this. I would like you to read this story aloud for me. Please start here and read aloud. This is not a race. Try to read each word. If you come to a word you do not know, you may skip it and go to the next word. This is a very generic kind of reminder to the students that this is what's happening. If you're using, okay, what was that? This is from Ames Web. So this is another one of those, this is one of those commercially available. If you're using Ames Web, you're going to be directed to say something very much like the generic one. Start here, read each word, I'll help you. Be sure to do your best reading. If you are using Dibbles, you're going to find something like this. I would like you to read a story to me. Please do your best reading. And later in the Dibbles manual, it does say that oral reading fluency in connected text is not speed reading. So I hope that the point I'm making here is, even if you don't actually read the directions verbatim to your students every single time, it is very important that you don't allow your students or encourage your students to speed read. That actually breaks the protocol. If you allow speed reading and certainly encourage it, then you're not following those standardized procedures that do say, I want your best effort, but best effort means best reading, and that is not speed reading. It's not reading as fast as you can, and I will spend a little bit more time later talking about that. So when we're using the ORF assessment, what are we really measuring? And I will just give you a little hint to this conversation. We're going to talk about this more than once here today, but we're not measuring text reading fluency. And this is very complicated, isn't it? Because the name of the assessment says we're doing oral reading fluency. But when we really look more deeply at what reading fluency is, and Deb Glazer and I in our book came up with a definition that helps represent the complexity of reading fluency. We say that reading fluency is reasonably accurate reading at an appropriate rate with suitable expression that leads to accurate and deep comprehension and motivation to read. That's our definition. When you look at Scarborough's rope, she's saying that fluent reading is demonstrated. Fluency is part of skilled reading. It means the fluent execution and coordination of all those component pieces, the text comprehension and the word recognition. We're not measuring all that complexity in a 60-second measure. It's not reading fluency in its most careful definition. It really is a measure of automaticity. It would have been much better if the developers of this measure had called it an automaticity measure, maybe an oral reading, oral assessment of automaticity, or something like that. What we've learned is that, however, that although it's not really measuring the complexity of reading fluency, it is a very, very important tool for us. It functions like a thermometer. It's an indicator. It's a powerful indicator of students' progress. Early on, those early assessments, letter naming fluency, letter sound fluency, nonsense word fluency, are really powerful indicators of whether a student's on track or not. And once we get to oral reading fluency, it is a powerful indicator, but not a diagnosis. And the reason we can be so confident about it, and the reason so many schools are using these assessments, is because we have this large, strong, and it continues to grow body of evidence that has examined the power, the value of curriculum-based measurement, particularly ORF. That is one of the most studied assessments that you can imagine. One of the studies, like we don't have any interest here in going over 40 years of research, but this one study is very indicative of that 40 years of study on oral reading fluency. And I think it very powerfully shows why we should use the ORF measure and what it does indicate to us. It doesn't measure fluency, but let me walk you through this study. In this study, these researchers took a group of fifth graders, and these fifth graders were all struggling readers. They were not really strong readers. They knew that going in. The first thing they did with these fifth graders is they gave them a very extensive assessment of comprehension. And so they knew what their comprehension score was, and they wrote it over and put that score to the side. And then they administered these four other shorter classroom assessments. So they had these students read a passage and do a retell. They took that score and did what's called a correlation. They compared those two scores to see how close they were to each other. And they found that a retell predicted comprehension at 0.70. And if you have a research background, you have a master's degree or whatever, you may know that a validity coefficient of 0.70 is quite strong, that students' retell is a pretty good predictor of their comprehension. They administered a closed test where students literally guess what word is missing in a sentence. That correlated at 0.72, still quite strong. They had these students read a passage and answer some multiple choice questions. That correlated with their comprehension, very strong, at 0.82. And then they did a 1-minute passage read using the oral reading fluency standardized protocol, compared that words correct per minute to their comprehension assessment, and got the truly astounding, almost unheard of correlation of 0.91. The highest correlation you can possibly ever get is 1. And you only get that when you correlate something to itself. So 0.91 is essentially saying that of all these assessments, that little 1-minute assessment of words correct per minute is the best predictor of students' true comprehension. Now, 0.91 is not perfect. We know it's not a perfect indicator of comprehension, but because it's so quick and we can do it so accurately and efficiently, and that we have these 40 years of research that tells us it is a moderate to strong correlation or predictor of reading comprehension. That's why we use it. So now I'm going to walk you through, I've sort of touched on some of these before, but I know that, I was a reading specialist. Jessica talked about that. Before I became a professor and a researcher, for 15 years, I was a reading specialist. And I still work with students. I remember when I was first told about this little 60-second measure, and I was really rather appalled when I first heard about it. It was a long time ago, I have to tell you, but I just didn't believe that it could be a really important tool in my toolkit, because I had some of these confusions about ORF. So I want to dissuade you of these confusions or these mythologies about the ORF measure. I would say probably the most common confusion about ORF is that it does measure fluency. And we've already talked about that. It does not measure fluency. It is really unfortunate that these assessments were called oral reading fluency. There's people who were on that original team over 40 years ago that are in complete agreement about this. We did a disservice. I wasn't part of that team, but a disservice was done by calling it a fluency assessment. It really is an assessment of automaticity, which is the rate. It's the accuracy, words correct, per minute. That's the rate. That's an essential part of reading fluency. But what it really is automaticity. And as I talked earlier about, fluency itself is complex. Text reading fluency is quite complex. And we would really need to do a measure that would go beyond just 60 seconds to truly measure fluency. So, okay, we know that now. Number 2, I would say the second most common confusion is that what we want from our students is the highest ORF score possible. And that is not true. What we know about rate, we know quite a bit about rate, just how the speed with which kids could read. And what the research tells us is that we want students to be able to read in grade level text somewhere around the 75th percentile, but no lower than the 50th percentile. That just reading faster and faster and faster is not beneficial to students. And all of you who work with students, who some of them like to read really fast, we know that fast reading can be detrimental if our goal is comprehension. We do know that the 50th percentile is essentially important. And I want to give you some of the newest information about that. This was a study done by some folks and published in 2021. And these folks went and looked at the NAEP score, which is essentially it's essentially a comprehension assessment, a very in-depth comprehension assessment. And they looked at the 4th grade scores on the NAEP. And if you're familiar with the NAEP, you know it categorizes students based on their comprehension into categories labeled advanced, proficient, basic, and then there's 3 below basic categories. What they did is they went back and correlated the placement of the comprehension performance with their words correct per minute score. And what they found, and when they looked at these scores, and compared to norms on oral reading fluency, such as the work that my colleague Jerry Tyndall and I did to identify what is the 50th percentile, the 75th percentile, etc. What they found with these 4th graders and looking at the Hasbrouck and Tyndall norm, they said that the students who performed at the advanced level were reading on average in that group around 160 words correct per minute, which is exactly the 75th percentile on the Hasbrouck and Tyndall norms, the latest version. The Hasbrouck and Tyndall 50th percentile on our newest norms is 133 words correct per minute at the end of grade 4, reading 4th grade material with no practice. We've always said that it's really important to think of that 50th percentile as a range of scores. So you take 133 and you add 10, and you take 133 and you subtract 10 to give you a range of scores that is functionally the 50th percentile. And look at that. That's almost exactly what is the range between the basic and the proficient comprehenders on the NAEP test. And that those students then who are below, somewhere around or below 105 words correct per minute are the students who are below basic on the NAEP assessment. So that is the recommendation here in terms of rate. It is not faster and faster and faster, but it is crucial that we do the best we can to get our students as close to the 50th percentile as possible in terms of their oral reading fluency score. The third common confusion, I hear this a lot from people. I get it as a practitioner too. We really should be assessing comprehension. That's the point. Automaticity is not the point. Fluency is not the point. The point is comprehension. So I say, sure, we should be assessing comprehension. But the problem with that is comprehension is super complex. It is an incredibly complex thing to measure. We can measure it, but it does take a lot of resources. If some of you on this attending this webinar or watching it later, the recorded version, if you're a school psychologist or a special educator who does these comprehension assessments, you know that they take at minimum an hour. They are multifaceted. They're often done over a couple of days because they're so lengthy. We can assess comprehension, but it just takes a whole lot of time. And remember, we've got this little tool that we have 40 years of research that say if we want at least a sense of our students' comprehension, we can use that ORF assessment. And this was the study I shared with you, was done in 2001, but there's newer research. The research on these assessments continue. This was a huge study, a longitudinal study done over 3 years from kindergarten to grade 3 with over 12,000 students, where they used ORF in the form of dibbles. And the students were also assessed on their vocabulary and the Stanford Diagnostic, which is a common research tool to measure comprehension. And they found that ORF best predicted the growth in ORF across first grade, from the early first grade to late first grade, was the best predictor of third grade comprehension. In second and third grade, it was those fall ORF scores that best predicted comprehension. So when you're using ORF, you're not ignoring comprehension. It is a tool that we have that's efficient and effective for giving us that peak. Is a student on track? Are they likely going to be able to read well enough to comprehend? It is a good tool to do that. And the fourth common confusion that I'm going to share today, there are probably others, but I would say that this is the one I hear a lot of, and that is this. A lot of schools are using oral reading fluency, words correct per minute, as a benchmark screener. And the problem is, I see people then saying, oh, students who are low in their words correct per minute, they did not reach benchmark on this fluency assessment. If they're not on benchmark on this assessment, what we should do is put them in a fluency intervention. So the answer to that is maybe. Maybe they need a fluency intervention, but it sometimes is a little bit more complicated than that. What we need to remember is that ORF is a thermometer. If we remember that it functions as a thermometer, we're going to use it more accurately. I have long thought about how this tool is our thermometer. And when we think about thermometers, we know that ORF and thermometers have a lot of things in common. They both have proven reliability and validity. You may recognize those words if you've taken any educational psychology or assessment courses. Reliability essentially means that you get very consistent, trustworthy scores. Validity means the score that you get has some value to it. It can help you make an important decision. So we know that about a thermometer. It's very reliable, very trustworthy, and it does give us a very important score. Both of these assessments also can be used quickly. I mean, a thermometer these days, it's instantaneous reading. We don't have any instantaneous way of measuring reading these days, but 1 minute is pretty darn quick. So we have proven from research reliability and validity for both these tools. Both can be used quite quickly. And at the end, after you use a thermometer or an ORF score, you have a score that you compare to a benchmark. Now, we've done a lot of talk about that here today on ORF, but you may not have thought about that for a thermometer, but that's what you're doing. When you get that score, you're looking for somewhere around 98.6, because that is an established benchmark for human body temperature. Now, just like oral reading fluency, where you add some and you subtract a little to get a range, there's a range of normal for human body temperature too. But that's what it is. It's a benchmark that we're looking for of human body temperature in the healthy range. And that has been established for well, close to 200 years now from research. But as good as a thermometer is, we know, physicians know, parents know, that it's not diagnostic. When a physician takes your temperature, or a parent takes your temperature, you say, oh my gosh, my child has a temperature of 103, or if that happens in a hospital setting, 103 temperature is not good. It's above benchmark. It's an indicator that something is not right. but it doesn't tell you why. There are many reasons that someone can have 103 temperature, ranging from these days COVID, influenza, many other infections. A physician once told me an elevated body temperature can be caused by a ruptured appendix. So it's not diagnostic. It simply tells you something's either looking reasonably right, or it's not. And we have to then use our professional judgment or do some additional assessments. So if we're using an ORF and the student is not where we want them to be, they're not where they are showing fluent execution and coordination of reading at their grade level, they're stuck over here. Does that mean that the problem is fluency? Well, my answer to that before was maybe. It might be fluency, but it's also possible that the reason that the student is not able to read text fluently for their grade level is because of some underlying skill deficits or skill weaknesses, including language. We're getting more and more sophisticated about our understanding the role that language and background knowledge and word literacy, vocabulary knowledge of the meaning of individual words plays in overall reading. So we need then to turn to that set of assessments, the diagnostic skills assessments that help us answer that question. Does this student need help, or what help does this student need? So I hope that's helpful to you in our discussions here today, that those are very common confusions. And if you do have some additional questions about that, I'd be very happy to try to answer them for you. So wrapping up the formal part of my presentation, I want to review some of the takeaways that the points that I've made, I hope, have been clear and helpful to you here. I do think it's very important. We're using, a lot of us are using oral reading fluency assessments these days, as I think we should. It's not the end all be all of all assessments, but it is very valuable. So I do think that all of us who are using this assessment, the stakeholders, administrators, teacher specialists, parents who are often given these scores, should understand the administration, the importance of doing it, administering these assessments, these simple assessments, but they are standardized, and then how to correctly interpret ORF data. It's not an indicator of fluency in terms of text reading fluency. It's an indicator of automaticity, which is a major contributor to overall reading. But it doesn't tell us everything we need to know. So that's the second takeaway. ORF, this strange, funny little tool that we have, is our thermometer. So physicians have their quick assessment, and we have our thermometer. And low ORF scores do indicate a possible reading problem. If it's low enough, it probably is a reading problem of some kind, but that score alone cannot diagnose or identify the underlying concern. And the third takeaway, we haven't really spent time in this session focused on what reading fluency really is. I quickly went over that definition that Deb and I have in our book, and the definition that Dr. Scarborough uses on her reading rope infographic. But the message really is, when we are thinking about fluency, the end goal is for our students to read well, not read fast. And that is partly, I think, partly a takeaway of how we should use and interpret that ORF assessment too. It's not about faster and faster and faster and faster. Helping our students read well, somewhere approaching the 75th percentile would be ideal. Minimally the 50th percentile is an indicator of that optimal reading that leads to, we hope, deep and accurate comprehension. And we also hope motivation as well. So a quick little overview of oral reading fluency assessments. I hope that I have, in fact, confirmed a lot of what you knew, or perhaps given you some new ways to think about this test. And be very happy to continue the conversation after this webinar. You can, I have a lovely community going on Twitter. If you are on Twitter as well, at Jan Hasbrouck. The only thing I tweet about at all is reading assessments and reading articles and research and conferences and those kinds of things. So it would be lovely to connect with you on Twitter too. So Jessica, I presume there might be a question or two.
There are several questions, so I'm really excited to get to those. And thank you, Dr. Hasbrouck, for an amazingly thorough, not too quick, just wonderfully thorough presentation. And yes, we do have about 15 minutes for questions. And before we do head into those, why don't we pull up the survey so we can get a sense of who is here. This is one of the ways we take attendance for clock hours. So please do fill out the survey and stick around for these questions, which I'm sure we'll find just as illuminating as this wonderful presentation was. So on to the first question we have. If a teacher is using ORF to progress monitor outside of benchmark periods, how often should they aim to assess students with ORF?
Very good question. And I'm unfortunately not going to be able to give you a really too simple of an answer, because this is one of the areas, actually, although there's 40 years of research on curriculum-based measures and especially on ORF. One of the areas that has not been as researched is the use of ORF for progress monitoring. There are lots of good studies done, but not enough yet that we can be definitive enough to answer that good question. How frequently should we assess our students? We don't know. I will tell you, because I was really, I wasn't part of that original team, but I learned about ORF and started learning about the origins of ORF really early on. And I know when they first developed those procedures and went out to field test them in a nearby school. So this research originally was done at the University of Minnesota. So the researchers went into the schools in the Minneapolis area and wanted to test out these procedures. And they really focused in on progress monitoring. They told their teachers that they should progress monitor their students, wait for it, 3 times a week. Okay, that was what the researchers thought would be optimal data collection. And those sweet, lovely teachers in Minneapolis said, "We're going to assess kids 3 times a week. We're not going to do that. That's crazy." So more typically these days, at maximum, we might do once a week. That would be really the maximum. Some districts have policy around twice a month for certain students, once a month for other students. And those are policy decisions that are not based on really solid research. The guidance we have is this. Here's the general recommendation I can give you. Just the higher the need of the student, the more data we need. Okay, this is exactly parallel to the physician's world. If you're a well person, you're basically a well person, the amount of data your physician needs is very little. Once a year, annual exam, that's fine. You do something, so you're not so well anymore. You break your leg or something, then your physician team now is probably going to need a little bit more data. You're going to have an x-ray, you're going to be checked by a physical therapist as your leg heals more often. If you are in intensive care, you are very, very ill or injured, the amount of data is going to be really extreme. I mean, if you're intensive care, it's 24/7. That parallel is relevant to us too. A student who's basically on track, we're pretty sure they are 3 times a year is probably enough, just those benchmark assessments. You're getting some help in a tier 2 setting. You're going to want to be assessed for progress monitoring more frequently, once a month, maybe, twice a month, maybe. If you're receiving tier 3 services, you're on an IEP, you're really far behind your peers, once a week might be adequate. So those are some general guidelines, but a very, very good question. And I hope that general guidance has been helpful.
Yes, wonderful. So another question that came from the audience is, so if fast reading is not our goal, when we progress monitor for fluency, do we still want to see words correct per minute growth if students are already at benchmark?
We do, up until a certain point. I think part of the handouts today included the newest version of the Hasbrouck and Tyndall chart. So you can take a look at that. And if you look at the 50th percentile, which we can think of now as sort of minimally benchmark, if you look at all of the grades, it does increase across fall, winter, and spring. So we do know that our students, even when they're beautifully at benchmark, that there is room to grow for most of them. If you're, though, talking about a student who, say, is at the beginning of 4th grade and you're doing a fall assessment of oral reading fluency, and their ability to read 4th grade text is at the end of the year 75th percentile, I would strongly say that student is fine and does not need to read any faster. What I would do is keep my eye on that student for making sure that they continue to maintain their fluency. Their fluency looks, or what we would call their automaticity, looks just fine, and very likely their fluency and their comprehension is just fine. That's all wonderful news. We don't need to see them get faster. What we want in growth for that student who's already at end of year benchmark, I want growth in vocabulary. I want growth on stamina, that they can read longer and longer passages. I want growth on background knowledge. I want growth on writing. All of those things take time and instruction, and they're not as easily measured as words correct per minute, but that's a really astute question. Most of our students typically performing or having a little bit of trouble or growth as we definitely want to see, but not for all of our students.
Wonderful. So another question that came through is, what is appropriate progress to expect from students? Is there a number of words per week we should be aiming for?
There is, and I did not include that in the presentation today or the handouts, but there has been some work where people look at norms like the ones that Jerry Tyndall and I created and extrapolated words per week for a typically developing student at each of those grade levels. So they do exist. There was a study done in the 90s by Lynn and Doug Fuchs that delineated those scores. Some folks at the Read Naturally company have created a little chart that shows growth over time as well. So yes, they do exist, and they do. I haven't memorized what those numbers are, but in general, I think it's about 2 words a week in 1st grade and about 1 word a week in 2nd grade. And as students get up in the grades, it gets down to a half a word or so per week, because the growth they've really made most of the growth that they're going to make. So those charts do exist. I don't have one available for you right now.
We might be able to pull one up and put them in the Padlet.
That would be great.
Another question from an attendee is, I notice the younger ones really get distracted when I mark the paper. Lots of questions about that, so they stop reading. Any tips on what to say before the minute starts?
Yeah, and I know that that's true. As I say, I wish sometimes I've counted how many students I've done these kind of assessments with, but it's many hundreds for sure. And I certainly, and the younger students are the most anxious about it. They're newer to this assessment and they want to do everything right. So one of the things I do for sure is make sure that they're not that where I'm scoring is hidden from them. I try to use, I know a lot of times nowadays, as all this, the new bells and whistles we have, we're using electronic devices to score procedures. You can, if you're using the old fashioned clipboard, you keep it away from the student and use very minimal marking so that, or I try with a really anxious student to put some little mark on every word. So they see the pencil moving like a little dot on each word so they don't get distracted. Oh, her hand moved. I must have done something wrong. Another idea is to record the student and score it after the fact. That may not be quite as precise, but this is not, at the end of the day, a super, super precise instrument. We're trying to get within a word or two. So for very anxious students, you might try something like that, record it on the phone and say, that was lovely. You did a great job. You're done. And then I score it afterward.
How young can students be to start taking ORF assessments?
The research that we've done starts ORF in the middle of first grade. As a general screening. So that's those universal, we're talking about all first graders. We start in the middle of first grade. I know, and you know, that there are children who show up on the first day of kindergarten who are readers. That's wonderful to see. And we have no norms that I'm aware of for those younger students. So if you wanted to do a 1-minute assessment for those before the middle of first grade, you can, and then compare and use first grade materials is generally what I would do. And then you can compare them to first grade readers, but you can also be really informal with this assessment and simply listen to a child read and use your good teacher judgment and say, this kid's fine. This kid's doing a wonderful job, even if we don't have norms and benchmarks. For those younger students, typically who are not reading text, we use those letter naming fluency, letter sound fluency assessments. And we do have norms for those.
Can you do error analysis on ORF assessments to better understand what students know?
That's a reading teacher, I think, asking that question, or somebody with a reading background. I've actually done a study on that, a published study. We did this back in the 90s, where we actually asked that question. Is the analysis of errors in a 1-minute assessment, does that add value? Decision value? Does it enhance the decision? Does it improve the decision making at the end of the day? And we found it does not. And for this reason, I think it's just too short of an assessment to have a lot of errors. It would be better, and error analysis is a huge tool in my toolkit when I'm really wanting to do a deep dive on a student's fluency, not just their automaticity. I'm going to have them read for more than a minute. I'm going to have them read passages that have lots of different kinds of words in it, so I can see some patterns. There's no reason you can't or shouldn't. I'm not going to tell you you shouldn't do an error analysis, but when we've really looked at the value of doing that in a 1-minute read, we haven't found it to be that valuable. But I do it myself, but in a longer read.
Okay, great. And I think we have time for one last question.
Okay.
How important it is to understand the grade level percentage according to the Hasbrouck and Tyndall norms chart? What do teachers need to know about that to use it in their assessments?
Oh, I'm having a trouble with that question because grade level or maybe percentile, is that?
Perhaps.
Yeah, percentage is, those two words sound so much alike and they get confused. Percentage is a ratio of words correct to not correct, and you can calculate the percent correct on a 1-minute assessment if you want to do that. The norms are percentiles. And the percentiles are rankings of scores. They don't pay any attention to how many correct, except that's embedded in the score, words correct per minute. But a percentile is simply a ranking of the thousands or millions of children who took that assessment. The most recent study that Jerry Tyndall and I did, we did examine over 6 million scores, and we used those to create the percentiles. I think it's important that recent study that was done comparing percentile performances to NAEP scores. That study really does show us that percentile does have meaning, and it has meaning in terms of its prediction about comprehension, which at the end of the day is what we care about. So based on that study, the percentile of the 50th percentile at each grade level at each time of year is really, really important. We want to help our students get there minimally, but remembering that getting them above the 75th percentile has no value for comprehension. So I hope that's answering the question that this person was asking.
Wonderfully. Well, thank you so much, Dr. Hasbrouck, for joining us today on behalf of Glean Education and the Washington State Department of Education, OSPI. We were thrilled to speak with you today.
Thank you.
Thank you
It's
so
a pleasure
much.
to be here.
And thank you for all the attendees. Please do check back for future webinars in the series.